where people will feel awkward regarding that whole rib compression thing, putting people on their sides and getting the weight on the side of the rib cage to try to.
Cheyenne, you wanna come up and lay on the table a little bit?
Do you want to? I like how it's always fixed. I always joke with her, like.
I order people around.
Do you want to? You tell me to. So, I'm feeling nice and warm. So if you just lay on your side for me somewhere. I got it.
Well, that's kind of a weird one.
Yeah, I think all of the square bolsters are in the other classroom.
All right.
So you're just wondering.
You want this one?
Well, that one's all right, yeah.
Yeah, for the time being.
And then a pillow, and
Yep.
we'll get into a little bit more after lunch
Just a
on
second.
bolstering and stuff. Now this, what you add for the breathing is a concentration on the pressure on the thorax. That's the only thing that is additive to this.
So the idea here essentially was, I realized that the awkwardness has been, how do I deliver, because one of the best strategies I have in general for like breathing related dysfunction, one single application is that sustained weight and compression on the side of the ribs, brings the ribs down. It's the best way we can even interface with the intercostal muscles between the ribs, because you basically force everything into an exhale position. And by holding the rib cage down like that, it'll get them to use their diaphragm more effectively. So anything neck and shoulders, anything, think upper cross syndrome, all that applies. Open the chest wall up, bring their shoulders down, make their ribs more pliable. But being able to do this big, broad-based compression on the side of the rib cage gets awkward. How do I get my arms set? Do I lay on a person? Do I sit on a person? And I went, well, we have these stupid weighted hot packs. Why don't I just stack them? I'm going to bring your arm up a little bit. Bring this over, and then if I incorporated that plus my compression, now I have the weighted hot pack displacing the pressure. Now pressure, okay.
And it's not gonna be pokey on those ribs.
So if I just, and that creates a barrier too, right? So I could either, if I wanted to do more weight, I used to have some giants. I could then put my chest on those weighted packs and use my body weight. So,
Or a double arm.
yep, double arm, but I have the weight of the hot packs helping displace the pressure, creating a barrier and creating sustained weight. Or I can just leave them there. I just put some weight here and then go about the rest of the massage. Then I have this sitting here.
It will work with them on their back, and if they're on their tummy, it'll work, but it doesn't work nearly as good as if they're on their side. That's where you're really gonna get the change in the rib cage.
I recognize that for a lot of people, it'll feel awkward to figure out how to comfortably get yourself feeling like you can work on the side of the torso without one, it being too pokey, or worrying too much about the draping. So if you have to do something that isn't working more directly on the area, using something else, using a weighted component to help you, rather than you doing it all, I just went, well, you know what? That's idiot proof right there.
Yeah.
If you have access to something with weight, use that instead of worrying about.
See, this is what I would do, you know, I get it. But there's a lot of issues around this, you know, and then this is secondary. Did you feel that? No. Oh. Because if I come down narrow, it's gonna negate the effect. So I have to come across big, I can do this. This is hard on me then.
You know, serratus anterior is the biggest muscle, but it doesn't have a lot of density to it. But that has a lot to do with not only breathing, but also scapular mobility. And the two are gonna come together. You know, assume, when I said upper cross syndrome, any newbies, if you don't know what that is, we'll get have people stuck here, just like with low back, everybody's stuck in a seated position. Just assume that, but finding effective ways to work here, especially serratus and lats, it's very beneficial. However, it tends to be awkward for massage therapists to figure out how to incorporate in their sessions. So even if you really have a tough time, or you have a client that maybe is tiny and bony and all that kind of stuff, can't go wrong.
And I just kept
Squashing
piling weight
squashing the
on it.
weight, that'll bring the muscle tone down and it'll squish the rib cage.
And then once I got a weight, I can move her, bring her forward, bring her back. I can have her take a deep breath. I can have her cough. That's about mobilization. It's not trying to get them to breathe a certain way. That's about mobilizing all of
Now,
that.
confirming a person doesn't feel like claustrophobic and stuff like that.
What's that feel like? I keep applying, you know.
Don't really feel.
You think the weight of the stuff is doing But you can also leave things like this, especially for low back related dysfunction. That's something that I used to use a ton, was I would just like layer these hot packs with the weight on the low back while I did the rest of the massage.
You'll feel
And then they turn their sides, same thing.
Oh,
You know, because you have the whole lateral fate, even if I just layer across the whole side of the body, it's still creating a dampening and a compression effect on the tissue in general. So we're talking muscle tone and connective tissue pliability. So if I have that sustained compression plus some heat, I mean, that's it's a very non-invasive, super easy way to get potentially better effect. Worst case scenario, it doesn't really do anything all that profound for them, but it's a good strategy to see if it gets a positive response versus me just going right into a deep release technique. Why don't I see if doing something like that works really good before I just slam in and go after QL? Why not see? And if the less invasive, less labor intensive option is just as beneficial, why not go with that? All it takes is having the access to the materials.
And when
Just like bolstering, good bolsters, having a nice square bolster goes a long way.
And when we come back from lunch, we'll do a little bit of setup on demonstration with that. The only other thing I would add in is that for stress management is make sure that you are working the shoulders. And because people, if they're stressed, have a tendency to breathe with their shoulders. So now, all of that stuff being said, all the information I sent you and supplemental information in the handout provides knowledge so that you're applying this stuff intelligently and you're able to explain to them why these types of interventions make a big difference. So there's an accountability on your part to be well schooled in what causes the stress response, what is involved in a vigilance physiology, why does the autonomic nervous system kind of get stuck on, why people can't get out of it, and you know, what external factors might be in play with all of this. And you know, poor air quality, for example, is going to make you breathe different. If you breathe different, you're going to change your blood chemistry. If your blood chemistry is a certain way, you're going to get anxious. So now you're anxious, and and there's no real reason to be anxious. How confusing is that? Or you're wearing restrictive clothing where you can't get a full breath. And then you know, anything around the neck or anything too tight around the waist, or high heels, and that includes like cowboy boots and stuff. Anything like that is going to change how your breathing normally happens. It's going to force you into an upper chest breathing pattern. As soon as you do that, there's a whole chemical cascade of events that happen that result in vigilance. Vigilance turns into anxiety. And then you got this whole circle of hormonal change in it. and endocrine responses, and then a mental thing of trying to figure out what's wrong. And in some instances, nothing is wrong. You're wearing high heels. Stop that. You know, don't wear Spanx. Don't do that. You know, don't wear a tie. You know, don't put stuff. Don't have a choker around your neck. Don't do stuff like that. Don't wear your hair real tight. You know how sometimes the hairdo, it pulls the hair back real tight and your eyebrows are floating around in the middle of your forehead. That's gonna cause issues. And so people are going, ooh, and they're on antidepressants and anti-anxieties and the whole thing, and they don't know why. And it can sometimes be something like that.
And that also gives you good strategies if somebody comes in with their eyebrows on their forehead and they're wearing heels. You're like, well, I should think about their calf tone and maybe give them a good scalp massage, and maybe that'll help.
And the anxiety can also come from an inner ear issue. It can come from a heart irregularity. So we need to make sure when we're thinking about stress that other things that might be coming into play on that, and that those things are understood and checked out in some sort of a referral collaboration.
Something, because you mentioned the ear thing that we didn't talk about that we'll have to incorporate in some of the hands-on is the rhythmic rocking and joint movement interfacing on the vestibular side. The idea is to turn them into a rocking baby. And it doesn't, not just the physical rock, even your joint movement. It didn't matter if it was a sports thing or not. I incorporate joint movement all the time. The velocity of it and how passive it was related to the outcome. If it was more relaxation based, I was doing all the joint movement passively for them, and I wouldn't go to end range. I kept it real small, rhythmic, slow. So the joint movement would have the same pacing as the rocking. It's all interfacing on the vestibular mechanisms, which is going to directly interface with the autonomic nervous system. So weight plus some rocking and rhythmic joint movement, that's another piece that we need to look at.
So when we get back from lunch,
Well, call that good.